baby, but pregnancy just isn't happening? You may wonder if either you or your partner has a medical problem that needs to be checked out. Infertility doesn't always mean you're sterile or unable to have a child ever. Half of couples who get help can eventually have a child either through conventional medicine or a natural approach through traditional Chinese medicine. Both men and women can have fertility problems. In about 20% of infertile couples, both partners have fertility problems. In about 15% of couples, no cause is found after all conventional medicine and tests have been done. This is called unexplained infertility. However, a natural approach through traditional Chinese medicine can correctly identify real causes of infertility from a computerized meridian energy analysis system. The main symptom of infertility is not getting pregnant. Women with infertility may have irregular or absent menstrual periods, cramping abdominal, and poor sexual function. In some cases, men with infertility may have some signs of hormonal problems, such as changes in hair growth or sexual function. All of the steps during ovulation and fertilization need to happen correctly in order to get pregnant. Sometimes, the issues that cause infertility in couples are present at birth, and sometimes, they develop later in life. Abnormal sperm production or function due to undescended testicles, genetic defects, health problems such as diabetes, or infections such as chlamydia, gonorrhea, mumps, or HIV. Enlarged veins in the testes, varicocele, also can affect the quality of sperm. Problems with the delivery of sperm due to sexual problems, such as premature ejaculation, certain genetic diseases, such as cystic fibrosis, structural problems, such as a blockage in the testicle, or damage, or injury to the reproductive organs. Overexposure to certain environmental factors, such as pesticides and other chemicals, and radiation. Cigarette smoking, alcohol, marijuana, anabolic steroids, and taking medications to treat bacterial infections, high blood pressure, and depression also can affect fertility. Frequent exposure to heat, such as in saunas or hot tubs, can raise body temperature and may affect sperm production. Damage related to cancer and its treatment, including radiation or chemotherapy. Treatment for cancer can impair sperm production, sometimes severely. Ovulation disorders, which affect the release of eggs from the ovaries. These include hormonal disorders, such as polycystic ovary syndrome. Hyperprolactinemia, a condition in which you have too much prolactin, the hormone that stimulates breast milk production, also may interfere with ovulation. Either too much thyroid hormone, also known as hyperthyroidism, or too little, also known as hypothyroidism, can affect the menstrual cycle or cause infertility. Other underlying causes may include too much exercise, eating disorders, or tumors. Uterine or cervical abnormalities, including abnormalities with the cervix, polyps in the uterus, or the shape of the uterus. Non-cancerous or benign tumors in the uterine wall or uterine fibroids may cause infertility by blocking the fallopian tubes or stopping a fertilized egg from implanting in the uterus. Fallopian tube damage or blockage, often caused by inflammation of the fallopian tube, also known as salpingitis. This can result from pelvic inflammatory disease, which is usually caused by a sexually transmitted infection, endometriosis, or adhesions. Endometriosis, which occurs when endometrial tissue grows outside of the uterus, may affect the function of the ovaries, uterus, and fallopian tubes. Primary ovarian insufficiency, also known as early menopause, occurs when the ovaries stop working and menstruation ends before age 40. Although the cause is often unknown, certain factors are associated with early menopause, including immune system diseases, certain genetic conditions, such as Turner syndrome or carriers of Fragile X syndrome, radiation or chemotherapy treatment. Pelvic adhesions, bands of scar tissue that bind organs that can form after pelvic infection, appendicitis, endometriosis, or abdominal or pelvic surgery. Cancer and its treatment. Certain cancers, particularly reproductive cancers, often impair female fertility. Both radiation and chemotherapy may affect fertility. Men's treatment for general sexual problems or lack of healthy sperm may include changing lifestyle factors. Improving lifestyle and certain behaviors can improve chances for pregnancy, including discontinuing select medications, reducing or eliminating harmful substances, improving frequency and timing of intercourse, exercising regularly, and optimizing other factors that may otherwise impair fertility. Natural approach. One natural approach for infertility is the Nuvida system. This includes the use of premium herbal supplements, Nanovita Water, NanoHerbs Light, and Meridian Energy Analysis System. This natural approach may improve sperm count and likelihood for achieving a successful pregnancy. This natural approach may increase testicular function, including sperm production and quality. Surgery. For some conditions, surgery may be able to reverse a sperm blockage and restore fertility. In other cases, surgically repairing a varicocele may improve overall chances for pregnancy. Sperm retrieval. These techniques obtain sperm when ejaculation is a problem or when no sperm are present in the ejaculated fluid. They may also be used in cases in which assisted reproductive techniques are planned and sperm counts are low or otherwise abnormal. Women's treatment may include stimulating ovulation with fertility drugs. Fertility drugs are the main treatment for women who are infertile due to ovulation disorders. These medications regulate or induce ovulation. Talk with your doctor about fertility drug options, including the benefits and risks of each type. Many patients are seeking a natural approach through traditional Chinese medicine. Surgery to restore fertility. Uterine problems, such as endometrial polyps, a uterine septum, intrauterine scar tissue, and some fibroids can be treated with hysteroscopic surgery. Endometriosis, pelvic adhesions, and larger fibroids may require laparoscopic surgery, or surgery with a larger incision of the abdomen. IUI stands for intrauterine insemination. During IUI, healthy sperm are placed directly in the uterus, around the time the ovary releases one or more eggs to be fertilized. Depending on the reasons for infertility, the timing of IUI can be coordinated with your normal cycle or with fertility medications. The success rate of IUI is very low. IVF stands for in vitro fertilization. A human egg is fertilized with sperm in a laboratory dish, then implanted into a uterus. If the fertilized egg is successfully implanted in the uterus, this will result in pregnancy. But the success rate of in vitro fertilization is low, depending on the patient's age and healthy energy foundation. Complications of infertility treatment may include multiple pregnancies. The most common complication of infertility treatment is a multiple pregnancy, twins, triplets, or more. Generally, the greater the number of fetuses, the higher the risk of premature labor and delivery, as well as problems during pregnancy, such as gestational diabetes. Babies born prematurely are at increased risk of health and developmental problems. Talk to your doctor about any concerns you have about a multiple pregnancy before starting treatment. Ovarian hyperstimulation syndrome, also known as OHSS. Fertility medications to induce ovulation can cause OHSS, particularly with assisted reproduction technology, in which the ovaries become swollen and painful. Symptoms may include mild abdominal pain, bloating, and nausea that lasts about a week or longer if you become pregnant. Rarely, a more severe form causes rapid weight gain and shortness of breath requiring emergency treatment. Bleeding or infection. As with any invasive procedure, there is a rare risk of bleeding or infection with assisted reproductive technology or reproductive surgery. Many patients went through surgical procedures, IUI, IVF. But all had failed. They had lost confidence in treatments. Two aspects often overlooked by patients are one's weak body foundation and organ energy imbalance. American Herbal Laboratories Incorporated has successfully developed the following premium herbal supplements to support and promote optimal health of your reproductive system. For female infertility, use Beauty Plus, Immune Up, Vita Brain, and Immune Cream. For male infertility, use Male Plus, Vita Breath, Vita Brain, and Immune Cream. American Herbal Laboratories has successfully developed Meridian Energy Analysis Systems. It's a valuable tool to assess how your organ energy functions affect your infertility. Dr. Luke also highly recommends these protocols with the use of Nu Vita's Nano Herbs Lights. It allows patients to achieve the results of acupuncture without the use of needles. It enhances cell growth and rebalances the cell's DNA structure. Herbs Light's main functions include 700 conditions, such as male and female infertility, slowing down the aging process, cosmetic improvement, scalp enhancement, pain management, meridian organ rebalance, immune system rebalance, and energy support for cancer patients. For infertility, Dr. Luke highly recommends the following acupuncture points: eyes, ears, aortas, navel, and kidney. Nu Vita herbal supplements are made from 100% premium natural herbs, harvested in America and Asia. They are manufactured in our US FDA-registered facility in Los Angeles, California, since 1994. They are prepared according to Dr. Luke's proprietary methods that have been developed over 40 years of clinical research, using both traditional Chinese medicine and nanotechnology. Nu Vita promotes your health by restoring your body's physiological balance and harmony. It also improves your organ energy, slow down aging process, and zest for life. Within a short period of time, your revitalized state should become apparent, with marked improvement in your appearance, disposition, physical strength, and emotional well-being. Nu Vita, supporting your health with 100% premium natural herbal supplements.